And welcome back. Well, if your doctor orders an MRI, X-ray, or CT scan, you may be nervous about being near those machines and if it's really the right way to go about your treatment.
Joining us now is Dr. Robert Wells from Medical Diagnostic Imaging with some reassuring advice about those scans. Great to have you on the Morning Blend today. Thank you so much. You're a radiologist at Medical Diagnostic Imaging. What exactly is diagnostic imaging?
Well, diagnostic imaging is a newer term, I guess, for being more accurate in describing what's historically has been called radiology, or still is called radiology. But since we now use machines that don't use X-rays for a lot of our imaging, diagnostic imaging is a more proper term.
Okay.
So now we have MRIs and ultrasound and nuclear medicine, and it's not just old-fashioned X-rays, which are still important, but it's gone beyond that now.
Has it gone beyond because the technology is just so much better than an X-ray?
The technology is changing, and X-rays are still the way to go for many things, like pneumonias and broken bones. But other technology has found a place for other diagnoses and more complicated things in general.
What types of patients do you see at MDI?
We're a full, MDI Medical Diagnostic Imaging is a full service outpatient center. And so we see patients of all types at all ages, and we care for a variety of conditions, newborns all the way to elderly adults we take care of.
And what are some examples of what you do there?
Well, we have usually the machinery and the staff are what determine what you can do. So we have MRI machines and CT machines and X-ray machines and ultrasound machines. So we do soccer injuries. We would be doing the MRIs to look at the knee injuries and the elbow injuries and the ankle injuries from athletics, and head injuries, CT scans. Patients with appendicitis we would be looking at, the good old broken bones and that sort of things, and ultrasounds.
This is actually an appendicitis, right?
Yes, that is a child with appendicitis. That's an example of an X-ray that would look the same, pretty much the same as it would have if you had an X-ray done in 1950 as in 2014. And good old-fashioned technology.
And what's this?
This is a CT scan, and this is an example of a child with appendicitis. And if you can see there, the arrow is pointing at an enlarged appendix, which is our main technique to diagnose appendicitis. So this technology has increased our ability to be very accurate in diagnosing appendicitis and decreasing substantially the number of patients who go to surgery and then it turns out their appendix is normal.
Right.
It used to be as high as about 20%. Patients would have their appendix out. It turned out to be normal. And now with the modern techniques like CT and ultrasound, we're down to less than 5% or 3%.
That's great.
So it's having a real impact on patients, some of these new technologies that you read about.
What if somebody's really nervous to have the testing done, whether it's an adult or a child? Do you do sedation, and how does that work?
Yeah, usually the first line is just information, reassurance. We've designed our centers to be comfortable and low stress, which goes a long way. And having staff that's experienced in dealing with people, particularly with kids, and knowing the right techniques to talk with the family ahead of time so the family can be reassuring to the child, and then to deal with the child when they're there. So we get a lot of patients through some long tests even without sedation, even young kids. We've done, for instance, MRIs on kids of all ages, although most young kids need sedation. So those that need sedation, once in a while you can do it with a pill, but usually it's a little IV and some medicine through the IV that helps you relax or take a little nap.
Do you always need a referral from a doctor, or can you walk into an MDI and say, hey, I want to get my back looked at? 99%
of the time you're going to come with a referral from your doctor. There's a few things, maybe not, like coronary artery screening, CTs, people will self-refer, and they're welcome for that. But most things we're working in conjunction with your provider, doctor, or other providers who refer patients.
People have gotten so involved, I think, in managing their own health care and much more aware of the services that are out there and what they need. How do you think people go about choosing a place to have this type of imaging done?
Well, I think in a lot of ways it's the same as choosing other things as a consumer, except maybe the stakes are higher. So you can think about the things like convenience and cost. But quality obviously is going to be a huge factor. And so there's a variety of ways people can judge the quality of medical things in general, but imaging in particular. Certainly with us, it's the interaction with your referring physician. The physician will have, the provider will have opinions on the best place to go. But you can do other things to research what places are like. Is there a radiologist on site? Is the site accredited? For instance, ours are accredited by the American College of Radiology, which is a rigorous ongoing process to assure the machinery is working properly, that those of us interpreting the x-rays are appropriately trained and up to date, and that the technologists are certified, the people that are usually running the machines.
Very important qualifications. Here's the information for Medical Diagnostic Imaging so that you can find one of their locations. There are 3. There's Franklin, Milwaukee, and Greenfield. All those phone numbers respectively are on your screen. You can also visit them online at mdiimaging.com for more information, and feel free to request Dr. Wells. Thanks for being here.
Yeah, and that's .org. I'm not sure if that's
.org. I'm sorry.
.org. Great to have you on the show.
Thanks
Thank you so much.